congratulate the Honourable Member for Brecon, Radnor and Cumtowie, I hope I get that correct, for securing this important debate, a debate that's very important to my constituents in North Northumberland. One of my constituents in North Northumberland recently visited some friends in the north of the county, near the border with Scotland, and sadly suddenly collapsed with a brain tumour. He was taken across the border to a Scottish hospital. But this hospital, as we've heard, couldn't diagnose him because they can't access English medical records. So this constituent's wife, if you imagine the scene, is now filling her husband's records in from scratch down the phone while he awaits and waits for an MRI that he can't get in Scotland because he's under the care of Northumberland Healthcare Trust. Mr Dowd, I'm alarmed to realise that our country seems to have several invisible lines running through it. If you have a stroke or heart failure or even a nasty cold on the wrong side of these lines, then your illness and your treatment come with strings attached. This is bad for my constituents and it's bad for our country. My constituents, you see, like I'm sure so many of our constituents, live cross-border lives. It's just their reality. They move across the border all the time to see friends, to go shopping, to seek medical treatment. But as we've seen, if they take ill on the wrong side of the border, they will receive a substandard treatment at times. And that's not because Scottish nurses or doctors, in my case, who are, there's anything wrong with their service. They're superb. But because those nurses and doctors have no way to access English medical records. There's no joined-up thinking here. Northumbria NHS Foundation Trust has actually recently tried to offer services, and there's a new Berwick Infirmary being built in Berwick. And they've tried to offer those services to patients from the Scottish side of this invisible line. But up to now, there has been a lack of take-up or interest, really, from NHS borders. That's something I hope to see change. The primary-secondary care link is in a bit of a black box. Patients have no idea where they'll be referred to from their GP. Will it be Melrose, or will it be Cramlington? Will it be Newcastle? Who arranges the appointment, you see, is defining which organisation will be the referral option. And it doesn't have to be this way, Mr Dowd. The technical solutions clearly exist, as we heard from the Honourable Member, but frankly, the SNP government in Edinburgh have no incentive to make this cross-border care work, and I am sad to see no SNP member here today, because they are ideologically opposed to the choices that could lead to a cross-border British healthcare system that serves all British people equally. And it's worse than that, Mr Dowd. I was contacted by one young constituent recently who works in the Scottish Ambulance Service. They live in my constituency in North Northumberland in the north of England, but they're hoping to take up further training in Scotland so that they can continue their employment. But the Scottish funding support won't cover them because they're not Scottish, and the English support won't cover them because they want to study in Scotland. So a British student who wants to study at a British university in order to save British lives can't do so. It's a farcical situation, in my opinion. This is the reality for many of my constituents, and we must get better at joining the dots, at realising that real people live holistically in the geography of where they are, which shouldn't be determined by what, in British terms, are invisible lines on the map. If this is the situation now, can you imagine, Mr Chair, the mess for healthcare if the SNP were successful in their policy of independence? Because of bad cross-border healthcare, my constituents are suffering, and the union that so many of us cherish is suffering too.